Early screening is important when it comes to any disease. Dr. Lawrence Newman with Las Vegas Urology joins us to share the importance of getting screened for prostate cancer. Doctor, good morning. How are you?
Good. Thank you very much for having me, JJ.
Absolutely. Thrilled to talk to you about this. It's such an important topic, especially for men over 50. It's essential to get screened for prostate cancer.
Yes, it's very important. The earlier any cancer is detected, the better the treatment results will be. In fact, a number of years ago, a government agency recommended less screening for prostate cancer. And with several years of lag time, it became clear that more advanced cases were coming through. There's about almost 300,000 cases of prostate cancer diagnosed per year and almost 35,000 deaths. So those are the numbers we're up against.
Well, yeah, those are some very intimidating numbers, quite frankly. Doctor, I'm very familiar with the different stages of breast cancer. Is it similar with prostate cancer that there are different stages that people are diagnosed at?
Well, yes, the earlier that disease is detected, the better the results will be. The main obstacle is making sure the cancer is detected while the cancer is localized just in the prostate and has not spread to lymph nodes or bones or other places that make it much more difficult to treat.
Speaking of treatments, could you explain to me HIFU?
HIFU stands for High Intensity Focused Ultrasound. That's one of the several treatments available for treating prostate cancer. The reason this discussion is timely now is because as of January 1st, Medicare made the treatment much more accessible to patients, and the treatments are going to be available in the local hospitals probably within a few weeks.
Oh, wow.
To treat prostate cancer. And once Medicare makes these decisions, then most other insurances usually follow with some time.
Well, it's encouraging to know the insurance companies are getting behind this procedure. But in terms of who the best candidate is for this solution, who would you recommend that is?
Well, one of the unique things about HIFU is that you can treat just a small area of the prostate, a limited area, and in being able to do that, you can minimize the side effects. So early people diagnosed early and with localized disease, hopefully even just one area of the prostate makes the treatment the most tolerable and with the least side effects.
Yeah, certainly that sounds like it has some value, absolutely. You're supportive of this treatment. You've seen good results with it?
Yes. Because of the insurance access, the numbers locally in Las Vegas may not be very, very large, but this has been available in Europe and other countries, and the research and results are very good with this treatment.
Oh, it's very interesting. So we're calling this treatment HIFU, I guess is the doctor's term for it. It's very interesting. It's now accessible through Medicare. Can you tell us a little bit more about how people can inquire about it, or at what point you talk to your patients about using this as an option?
Well, in any patient with a new diagnosis of prostate cancer, I discuss all the different possible options for treatment, which would also include various types of radiation or surgery or even freezing the prostate. And most people, ask a lot of questions and take some time to think about it and then make their own decision. There's not any very clear and obvious differences between the outcome in the average patient. So most people have to listen to what all the different side effects and choose a treatment plan that seems most tolerable to them.
Well, doctor, thank you for joining us to talk about this very serious issue for men. If they would like to get more information on the HIFU treatment, they can visit the website right there on your screen, newmanurology.com, right here in the Valley.